Hello, my name is Anne Kalama. The question of the day is identification and diagnosis of schizophrenia in our clients. Schizophrenia is a mental disorder that affects a person how they think, feel, and behave. It often leads to distortion perception, emotions, and reality. And how do you identify? There's a positive symptom but comes with abnormality, delusional, hallucination. Delusional is where you have fixed false beliefs, like e.g. thinking someone is spying on them. Hallucination, hearing voices or seeing things that aren't real. Diagnosed speech, they have an impaired speech, jumping between unrelated topics here and there, and also disorganized behavior, strange movement, talking to self, or inappropriate emotions. There are also negative symptoms: lack of motivation or energy, social withdrawal and reduced speech, flat or blunted emotional expression. The cognitive symptoms: poor concentration and memory, like they cannot concentrate. When they try to concentrate, it's very tough for them to concentrate. Difficulty in making decision and even understanding. Like when you try talking to them to understand a very simple thing, for example, how to cook ugali. Ugali is just boiling water and putting the flour, and but they'll be like, no, I cannot do that. They have a hard time. How do you diagnose process? Diagnosing schizophrenia requires clinical assessments and structured observation, guided by medical standards. This disease or this mental disorder always wants someone who is there, like a caregiver, like a nurse, as a nurse aid assistant, and step to diagnose, clinical interview, like obtain their history on what they do, how they behave, how they talk, so you identify their the clinical interview. That is how you know how is the background, the genetics, how do they behave, is there any person in their family, is it hereditary, or is it something that they have because of trauma. The people who they get trauma, they appear to be having such symptoms, schizophrenia. Then the mental status examination, assessing the client's appearance, just the appearance, the mood, the thought of process, speech and perception. This is the physical appearance, mostly because it's the mood, the thoughts, how they speak. Then the other point is diagnosis criteria. The class must show at least two of the following 1 month with continuous disturbance of around 6 months: delusional, hallucination, disorganized speech, diagnosed or certain the catalogue behavior or the negative symptoms. So because we talked about the positive symptoms, which comes with abnormality, and the negative symptoms, which comes with a lot of baggage in the brains. Don't forget that in the negative symptoms, lack of motivation or energy, the impaired speech, like they behave so weird, they take decisions making very slow. Sometimes could be because of stress, and so please do not confuse it with certain things. Then the other one is physical and laboratory tests, conducting blood tests or brain scan to rule out the condition, like drug use or brain injury. Sometimes these things come with brain injury, then we have observation and documentation. It's observing the record all findings accurate for reference and treatment planning. When you're treating this disease, do not make sure you have the observation and documentation. Sometimes it's going to be because of stress or anxieties, and someone will be talking, or stress because family issues or peer pressure. The addicts, especially the youth of today, they're using a lot of drugs. So sometimes have the observation and the documentation. What is the role of a mental health caregiver? Because I earlier said about caregiver, nurse aid assistant. A caregiver, they can be found in Portuguese hospital most of the time. They're there, observe and record behavioral changes. They they do not administer until the drug is allowed to be administered. They offer emotional support and medication at various reminders. In case maybe the doctor has given a specific time of where they're supposed to have their drugs, they keep it as a reminder of emotional support. Sometimes they'll be like, they had, as we talked about the hallucination, they might be seeing people hallucinating here and there, but if they're helped, they're able to make the right decision. In conclusion, early identification and diagnosis of schizophrenia are key to better management. You can have these places like KISE, the Kenya Institute of Special Education. They can be able to be regulated. Early diagnosis. As in sometimes you see people who are speech impaired, the speech as early when identified when at a younger age, especially when at a younger age, it's able to be corrected at a younger age. Consistency is the key. So I urge every client, every parents especially, do not neglect these people. Support them, give them that moral support that they can do it, they can become normal, and also try as much possible not to treat them as able differently. Give them emotional support. You can also become a caregiver in this. So once again, I'm Kalama presenting. Thank you.